Hello, this is Mirrakhimov speaking. I'm one of the cardiac anesthesiologists at the University of Kentucky, where I also serve as a director of point of care ultrasound within the Department of Anesthesiology. Today we do a part 2 lecture of a basic introduction to cardiac point of care ultrasound. This is a lecture for you if you want to expand your skills, and today we'll specifically discuss some advanced views with TTE and cardiac point of care ultrasound. I have no conflict of interest to report for this presentation. Our agenda for the day is quite busy. We will review the anatomy and image acquisition of advanced cardiac point of care ultrasound views, such as parasternal right ventricular inflow view, high parasternal RV outflow view, parasternal basal short axis view, parasternal aortic valve short axis view, parasternal apical short axis view, apical 5-chamber view, apical 2-chamber view, apical 3-chamber view, suprasternal view, and subcostal short axis view. It is very important for us to learn some of the probe manipulation techniques to overcome very limited and narrow imaging window of the heart with surface point of care ultrasonography. Remember, we are very limited by the ribs, bones, and lungs. Here are some of the probe manipulation techniques which we can use to optimize the image. This includes sliding, rotation, tilting, and rocking. We'll have some brief videos describing how to perform these maneuvers. Here you see sliding of the probe. This video you see the rotation of the probe. Next one is tilting. Another name for tilting is fanning. And here you see rocking of the probe. Please pause the video if you need more time to review this slide. So why do we need additional imaging planes? As we know, in some patients it may be difficult to obtain some views. With additional and advanced cardiac echo views, you get more data. You are quite often able to obtain additional cardiac structures and visualize relevant and major vessels. And as you will learn in the future lecture, there's a better alignment with spectral Doppler, which gives you a superior data and more accurate measurements. So let's talk about parasternal right ventricular inflow view. In order to image this view, first obtain standard parasternal long axis view, and then tilt the probe towards the patient's right hip. On the top left of the screen, you see a frozen image of a parasternal right ventricular inflow view. And on the bottom left, you see a video clip demonstrating the same. In this particular window, you want to assess the right ventricular function, motion of the tricuspid valve and its leaflets. You want to assess the tricuspid regurgitation with color flow Doppler. We'll talk more about color flow Doppler in the next lecture. Also pay attention for the presence of possible right atrial masses, right ventricular masses, and clots within the right atrium and right ventricle. Please pause the video if you need to review this slide in more detail. Next, we talk about the high parasternal right ventricular outflow view. In order to image this, first obtain a standard parasternal long axis view, and this time tilt the transducer cephalad and aim at the left shoulder, which is opposite in how you obtain RV inflow view. On the top right, you see a frozen image demonstrating the anatomy in this particular view. And on the bottom right, you see a video clip demonstrating the same. In this particular view, assess the function of the right ventricle, size of the pulmonary artery, degree of pulmonic insufficiency, and structure of the pulmonic valve. Sometimes you can visualize proximal blood clots in the cases of pulmonary embolism. Please pause the video if you need more time to review this slide. Next, let's talk about the parasternal basal short axis view, also known as the mitral valve level. In order to image this, first obtain a standard parasternal short axis at the mid-papillary level, and then tilt the transducer slightly cephalad, or towards the patient's head. On the top right, you see a frozen image with anatomy delineated. And on the bottom right, you see a live video clip of a basal or mitral level parasternal short axis view. In this particular view, you want to assess the size, function of the right ventricle and left ventricle, position of the interventricular septum, presence of any clots and devices, wall motion, and opening of the mitral valve. Please pause the video if you need more time to review this image. So next we talk about parasternal aortic valve short axis view. In order to obtain this image, you start from parasternal short axis mitral valve level and tilt the transducer for the cephalad. Sometimes you may need to adjust it slightly medially in order to image this view. Here's a frozen image with anatomy labeled, and on the right you have a video clip showing you the same. In this particular view, you want to assess the size of the right ventricle, its function, motion of the tricuspid valve, presence of the tricuspid regurgitation, size and function of the right ventricular outflow tract, function of the pulmonic valve, presence of any pulmonic insufficiency or pulmonic stenosis. You can also assess the proximal PA for its size and presence of any foreign bodies and clots. Please pause the video if you need more time to review this image. And our final parasternal short axis view is apical, where you see the heart at the apex. Just to remind you, at the basal level, you see the mitral valve, and the mid-papillary level, you see the mid portion of the heart, and here you see the apex of the left ventricle. Here on the left part of the screen, you see a frozen image, and on the right part of the screen, you see a video clip. Again, in this particular view, you want to assess the LV size, function, and wall motion. Again, here on the left, you see walls of the left ventricle labeled for you. Please pause the video if you need more time to review this image. Next, we talk about apical 5-chamber view. In order to obtain this view, first image the apical 4-chamber view, and then tilt the probe slightly anteriorly. So here on the left part of the screen, you see a frozen image of a 5-chamber view. Again, it's very similar to apical 4-chamber view, with the exception that here you also see the LVOT and aortic valve, which is considered to be a 5th chamber for this matter. And on the right side of the screen, you see a video clip demonstrating you the same. So you see slightly different left ventricular walls compared to a standard apical 4-chamber view. Next to the RV, you see the anteroseptal wall of the left ventricle, and opposite to anteroseptal wall is your inferior lateral wall. This view is quite good if you want to obtain gradients through the aortic valve and gradients through the LVOT, which you can use sometimes in order to estimate left ventricular cardiac output and index. Please pause the video if you need more time to review this slide. Next, we discuss apical 2-chamber view. In order to image this particular window, first obtain a classical apical 4-chamber view, and then turn the probe counterclockwise approximately 60 to 90 degrees. Here on the bottom part of the screen, you see a frozen image with anatomy labeled for you. And here's a live video clip demonstrating the same. Please pause the video if you need more time to review this slide. Next, we talk about apical 3-chamber view. In order to image this, first obtain a standard apical 4-chamber view, and then turn the probe counterclockwise approximately 120 degrees. Alternatively, after obtaining apical 2-chamber view, further keep rotating counterclockwise approximately 60 more degrees, and you should be able to get this view. Here is a frozen image on the right with anatomy labeled for you, and on the left side of the screen you see a video clip demonstrating the same. So here again you see slightly different walls compared to the apical 4-chamber view. You have anteroseptal wall next to the RV and aortic valve, and opposite to it is an infralateral wall. Again, assess the function of the left ventricle and its respective walls here. And also, similarly to apical 5-chamber view, this view provides you good Doppler alignment with aortic valve if you need to measure gradients of the aortic valve, and also if you want to measure LVOT velocities or left ventricular outflow tract velocities if you want to estimate stroke volume and cardiac output. Please pause the video if you need more time to review the slide. Some patients may have difficult windows for parasternal short axis view. In some of those patients, it is possible to obtain a short axis view via subcostal route. So in order to do that, first obtain subcostal four-chamber views, and then rotate the probe 90 degrees counterclockwise. If IVC is visualized, you may need to keep rotating counterclockwise until you see this image. On the top, you see a live image of the subcostal short axis view, and at the mid-pap level on the top, and the apical level on the bottom. Again, if you want to image more of the apex, you tilt the probe towards the feet. If you want to image more base of the LV, you aim towards cephalad or towards the patient face. Again, as mentioned, this view can sometimes be quite useful when you can't get a classical parasternal short axis view. Please pause the video if you need more time to review this image. So finally, let's discuss the suprasternal view. If not contraindicated, you can place a small pillow under the patient's shoulders to facilitate head extension. You can also ask the patient to turn their head slightly to the side. You place the transducer in the suprasternal notch with a probe marker towards the patient's left. You may need to tilt the probe posteriorly and inferiorly in order to optimize the image and improve visualization. On the left part of the screen, you see a frozen image with anatomy labeled for you. And here on the right part of the screen, you see a video clip demonstrating the same. This is a very important view if you want to assess ascending aorta, aortic arch and great vessels, and descending aorta for presence of any pathology such as aneurysms and dissections, to name a few. Please pause the video if you need more time to review this image. So in summary, advanced cardiac views provide additional anatomical information. They can be diagnostic in certain scenarios of cardiac emergencies, such as, for example, suprasternal view in type A dissection or presence of pulmonary clots via right ventricular outflow views. Some of the views provide excellent Doppler signal alignment for certain measurements, such as, for example, apical four-chamber view for gradients of the aortic valve and LVOT velocities. These views can be helpful when conventional ones are difficult to obtain. Finally, I want to thank you for your attention. If you have any questions, please do not hesitate to contact me on this email address provided on the slide. I wish you all the best and good luck.